This is a Group A strep test, and in this one we're going to do a multi-reagent extraction. We are looking for the antigen from the bacteria on the throat swab. So we will be using an antibody to test for it. We're going to put 4 drops of reagent A and 4 drops of reagent B. Pull this back out of here. This is colorless. When I add B, it takes on a slight pink color. It's not real dark here. Then I'm going to take my swab that I've collected, put that down in there and twist it a couple of times, and it's going to sit for 1 minute. Okay, our magic camera has made it 1 minute. Then we're going to kind of swirl it around a little bit, make sure we've got all of it loose from the swab. Squeeze this and pull it out to make sure that we keep as much of the liquid, wring out the swab as much as possible, and keep as much of the liquid as possible inside the tube. Then we're going to take this little tip that turns our tube into a dropper and insert that in here. We're going to open our test cartridge. Label it with our patient name. Again, just in case we're setting up more than one and they get wiggled around, then we don't have any question about who is where. And we're going to add 3 drops of the specimen to the sample well. As with all of our other tests, we're going to watch for it to migrate across here. We're going to look for a control line. Without the control line, the test is invalid. If there is a line at the test spot, that means our patient is positive. If there is no line at the test spot, it means our patient is negative. The difference between this one and some of the others is that we actually have to add a step to it to remove the antigen, to break up the bacteria and release the antigen so that we can then test using our antibody.